Hi, this is Dr. Manjunath, fertility expert and laparoscopic surgeon. Welcome to my fertility talk. Today I am going to tell you about the commonest procedure, the simplest procedure in infertility treatment, IUI. IUI means intrauterine insemination, also called as artificial insemination. So we need to understand the logic first. Why we do this is we are keeping a good amount of sperms and at the right time, means I'd say exactly during in and around the ovulation time, and at the right place means when the egg is released near to the egg. So this is how the logic works: right amount, right time, and in the right place. So by doing this, we are increasing the chances of egg and sperm meeting. So that's how we are increasing the fertilization chances. So what are the indications when we do is, in case of mild to moderate male infertility, suppose if they have less sperm count, less motility, that is mild to moderate. If it is a severe one, we may not suggest IUIs. In case of mild to moderate variety of male infertility, in case of unexplained infertility, they have done all kind of medicines, they have tried everything, they have tried couple of years, but still they are not conceiving, we suggest them an IUI procedure. Then the ovulatory factors, sometimes there will be issues in ovulation. So that time what we will do is we'll give some kind of medicines to correct that, and we'll make them ovulate. We'll make the woman ovulate, and during that time, if you do an IUI, we will have a better chance of conceiving. That's why we'll combine the ovulation intention with IUI. And endometriosis, mild to moderate cases of endometriosis, and in case of donor sperm, sometimes men will not be having any sperm, zero sperm. When we do a testicular biopsy, in that time, in that situation also, if the sperms are not there, then we suggest them donor sperms. So in that case also, we'll do the IUI. These are the commonest indications of IUI, and generally we do around 3 to 4 cycles of IUI before we jump into IVF. We will not usually suggest directly an IVF, but we try to do the IUI because the IUI is less cost and it's the simplest procedure. It's not a complicated procedure. That's why we suggest initially IUI 3 to 4 cycles of IUI. Then how the IUI procedure is done? We give the medicines to ovulation, for the ovulation, and during the how we do this IUI procedure means we initially give ovulation induction drugs for the wife, and we monitor that cycle by doing a scans and few blood tests. In case we require blood test, otherwise we won't generally do the blood test. With a scan only we will monitor, and we'll tend to know that when she is going to have ovulation exactly, roughly plus or minus 12 hours we will come to know. During that ovulation, in and around the ovulation time, we will ask couple to come. The husband has to come and give the sample. He can collect the sample at home. If he is collecting the sample at home, he has to bring the sample at his body temperature. He should keep the sperm in the pocket, touching to his body temperature, and bring it within 30 to 45 minutes. Or he can better to come and collect the sample at the center only. We have separate facility for the sample collection. After he collects and gives the sample, we process that, remove all bad quality of the sperms, low motility sperms, take only the good motility sperms and in a good amount. And with the lithotomy position, we insert a small catheter and inject the sperms into the uterus. Naturally, the sperms will be deposited in the vagina, but we are bypassing this cervix and keeping the sperms inside the uterus. This cervix is a big hurdle for sperm to cross, so we are bypassing that and keeping the good amount of the sperms near to the egg. It will be the ovulation will happen here, and the egg will be released. This tube is supposed to come and tip that, and the egg will be waiting here for somewhere between 20 to 24 hours. So we are keeping the sperms near to the egg, so that the sperm from here to here passes inside the tube and meet the egg, and fertilization is supposed to happen. So this is how we are increasing the fertilization chance. After we insert the sperm, the lady will sit there or lie down there for 5 to 10 minutes, and after that she can go home and she can continue to do her routine activity. There is no need of bed rest or there is no need of taking off from their work. They can continue to do the routine activities. So don't think that by doing the IUI procedure we need to take off, we need to have complete bed rest. Nothing like that. You need not take the complete bed rest. You can continue to work. So when you are going to get the result after doing the procedure, you need to wait for 14 to 15 days, and during this 14 to 15 days, we will be giving you some kind of medicines as a supportive medicines, some kind of progesterones. Then after 14 to 15 days, we will have a result test. Either we will do urine pregnancy test, you can do the urine pregnancy test at home itself, or you can come and do urine pregnancy test at our clinic, or the beta HCG blood test. Once it's positive, you will continue the same medicines. If it is negative, you will wait for the periods to come. We can try the IUI in the next cycle. So generally the IUIs are tried 3 to 4 cycles, means 3 to 4 months. What is the success rate in IUI? It's around 14 to 18% only. So keep that in mind. When we compare to IVF, where we have success rate of around 60 to 70%, the IUI success rate is only 14 to 18%. But cumulative success rate is 50 to 60%. Means to say cumulative means over a combined 4 to 5 cycles, the success rate is going to be 50 to 60%. So that you need to keep in mind. What are the risks involved in IUI? There are few risks like multiple pregnancy, sometimes hyperstimulation, means ovarian is called as OHSS, or an hyperstimulation, or multiple pregnancy. Instead of singleton pregnancy, people tend to have twins, triplets, sometimes bleeding, sometimes infection. These are all bleeding and infections are rare complications. Yes, multiple pregnancy around 8 to 10% chance that multiple pregnancy can happen. So this is about IUI. If you want to know more about the other topics, keep watching my videos. Thanks for joining me.